The first time they said it out loud, it was almost casual, like they were naming the weather. Drug seeking. Maurice Ellison heard the phrase from behind a curtain in a busy ER bay, half lit by monitors, half lit by whatever impatience lived in the staff's voices that night. He was sitting upright because lying down made the pain in his abdomen feel like a tightening belt. He was holding his own arm the way people do when they're trying to keep themselves from shaking. Not dramatic, not performative. Just a man trying to get through a wave of something he couldn't control. Maurice was a black grandfather in his early 70s, the kind of older man who still wore a neat cap when he went out and still said thank you, even when people didn't deserve it. He'd worked most of his life in maintenance for a city transit authority, fixing what other people broke. Quiet work, solid work, the kind that left your hands rough, your back sore, and your pride intact. He also had a medical history that didn't fit into an ER's quick little boxes. Years earlier, Maurice had survived a bad fall at work and a surgery that never fully solved what it promised to solve. Then came neuropathy that felt like a fire traveling down his legs at night. Then diverticulitis that flared up in ugly bursts. Then a kidney stone episode that left him sweating through his shirt. And on top of that, diabetes that behaved like it had its own agenda. He didn't come to the ER because he enjoyed fluorescent lights and plastic chairs. He came because sometimes the pain didn't give him a choice. The second time he came, the look changed. A triage nurse read his name, checked a screen, and her face did that tiny shift people think you won't notice. The lips tighten, the eyes flatten. Maurice noticed. He always noticed. He'd spent decades learning how rooms changed when he walked into them. He sat down in the waiting area and watched a white man about 20 years younger, moaning loudly about his back, get taken in ahead of him. Maurice didn't say anything. He told himself there were reasons. He told himself to be patient. He told himself not to get angry, because anger in an ER is treated like a threat, not a symptom. When they finally brought him back, the doctor asked questions like they were building a case, not a diagnosis. A case. How many times have you been here this month? Who prescribed your pain meds? Why are you asking for anything stronger? Do you have a regular doctor? Are you sure you're taking your medications correctly? Maurice tried to answer politely. He told them he had a primary care physician. He told them he wasn't asking for a high, he was asking for relief. He told them he was nauseous, he was dizzy, he could barely keep water down. The doctor nodded in a way that didn't mean agreement. It meant suspicion with good manners. They gave him a CT scan and basic labs. Hours later, they told him nothing life-threatening was happening, which sounded like good news until you realized what it meant in practice. It meant they could send him home without solving the problem. It meant they could treat his pain like a bad habit instead of a warning sign. They discharged him with a pamphlet and a lecture. And somewhere in the background, in the quiet machinery of the hospital's electronic medical record, a label settled into his chart like a stain. Drug-seeking behavior. It didn't look like a stamp on paper. It looked like a few words in a note, maybe a checkbox, maybe a flag. Only staff could see. But it changed everything that followed. Those words traveled ahead of him the way gossip travels ahead of a person in a small town. Except, this was a hospital. On the third visit, Maurice came in at 4 a.m. because the pain had climbed up his side and wrapped around to his back, He could barely speak in full sentences. His daughter Denise drove him because he was afraid he'd pass out at the wheel. She helped him inside, her face tight with worry. Denise was in her 40s, the kind of woman who carried a folder everywhere because life had taught her that paperwork was armor. At triage, the nurse asked Maurice to rate his pain. He said 9, then quickly corrected himself like I was afraid of sounding dramatic. 8, 8.5. The nurse's eyes flicked to the screen again. Denise watched the flick. Denise did not like the flick. They made him wait. Again. When he asked for water, they said no. When he asked for something for nausea, they said they'd see what the doctor says. When he asked if they could check his blood sugar, the nurse said it was in the orders, as if that settled it. By the time a doctor came, Maurice was sweating and trembling, and Denise had that quiet anger that makes a person unusually calm. She asked what the working diagnosis was. The doctor said they needed to rule things out. Denise asked why he hadn't received pain control in the meantime. The doctor said they didn't want to mask symptoms. Denise asked why he was being treated like he was lying. The doctor's face hardened just slightly, as if Denise had broken an unspoken rule of politeness. Then the doctor said it, not as an accusation, as an explanation. We've had some concerns in the past about drug seeking. The room went quiet in a way that felt like humiliation. Maurice stared at the ceiling tiles and wished for a moment that he could disappear. Denise asked what concerns. The doctor said, frequent visits. Denise asked what else. The doctor said, requests for pain medication. Denise asked whether Maurice had ever been caught with an illegitimate prescription, whether he'd ever tested positive for drugs he wasn't prescribed, whether he'd ever been flagged by a pharmacy monitoring program. The doctor did not answer directly. He pivoted. He said they were just being careful. Careful. That word gets used like a shield. They did imaging again. They did labs again. And then, after hours of delay, they found something that had been there for months, hiding in plain sight behind the he's probably exaggerating assumption. A mass. Not huge, not cinematic, just enough. Enough to be a serious problem. Enough to explain weight loss Maurice hadn't even mentioned because he thought it was just age. Enough to explain the anemia his doctor had been monitoring. Enough to explain the pain that kept dragging him back into fluorescent rooms. They admitted him that day. A surgeon spoke to Maurice with a different tone than the ER staff had used, as if the label in the chart mattered less upstairs. The surgeon said they needed a biopsy. The surgeon said they needed to move quickly. The surgeon said, gently, that this might be cancer. Denise sat beside her father's bed and felt something cold settle into her gut. Not just fear, something sharper, something that asked a question she didn't want to ask. How long did they ignore this because they didn't believe him? While Maurice was admitted, Denise requested his records. She asked for everything from the past year, including ER notes, triage notes, discharge summaries, medication administration logs. The hospital told her how to file a request. She filed it. The hospital said it could take time. Denise pressed. She was polite, but she did not let go. When the records arrived, they came as a thick stack of pages and a digital portal link. Denise read them like a person reading a language that suddenly mattered. She'd done this before for her own kids' school paperwork and her mother's insurance claims. She was good at details. She was good at patterns. She found the first mention in an ER physician note. Patient with multiple recent ER visits, behavior concerning for drug seeking. She found it repeated by another provider who had clearly copied it forward. She found a nursing note about Maurice being agitated when asked to wait, which in reality meant he had asked for help while he was in pain. She found a comment about inconsistent pain behavior because Maurice did not scream. He sat quietly. He clenched his jaw. Apparently that was suspicious, too. Denise also found something that made her put the papers down and stare at the wall. A CT scan report from months earlier that had mentioned a subtle abnormality and recommended follow-up imaging. It had been in the record. It had been documented. It had been ignored. There was no follow-up order, no referral, no phone call, no note saying the patient was informed. Nothing. It was like the finding had floated through the cestil and vanished. Denise looked at her father sleeping in the hospital bed, his breathing shallow, his face thinner than she remembered, and she felt rage so clean it almost clarified her vision. That is how lawsuits are born. Not from greed. From that moment where you realize somebody's indifference had a timeline and your loved one paid for every day of it. Maurice underwent a biopsy. The result was malignant. The surgeon explained staging and treatment options, chemotherapy and surgery, and maybe radiation, depending on what they found next. Maurice listened, quiet, trying to keep his dignity intact while his world restructured itself. Denise did something else. She called an attorney. The attorney was a black woman in her 50s with a voice that sounded calm even when she was furious. She asked Denise to tell her everything, from the first ER visit to the moment the doctor said, drug seeking. She asked for records. Denise had them. Denise emailed them. The attorney read them and called back with a different tone. This is not just bias, she said. This is deviation. This is neglect. And it looked like a pattern. They filed a notice of claim. They requested preservation of evidence. They asked for the hospital's internal policies on drug-seeking flags. They asked who could place such a label, under what criteria, and how it was reviewed. They asked for audit logs from the electronic chart to see who read what and when. They asked for the hospital's complaint history related to pain management and racial disparity. The hospital's risk management department responded in the way institutions respond when they smell liability. They became polite. They became careful. They became slow. In the meantime, Maurice's care continued. And here's the part that still makes Denise's hands shake when she thinks about it. Once the diagnosis existed, the tone changed. Suddenly, Maurice was, "Sir." Suddenly, his pain was treated promptly. Suddenly, nurses checked on him without being asked. Suddenly, nobody suggested he was seeking drugs. He was seeking survival now, so it was acceptable. Denise watched the transformation and felt sick. The hospital offered a settlement early, before discovery. It was framed as compassion, as a desire to avoid stress during treatment. Denise saw it for what it was, an attempt to keep the story quiet before the records started talking in public. Denise refused the first offer. They moved forward. During discovery, the attorney obtained internal communications, not dramatic emails saying, "We don't believe black patients." Institutions aren't that stupid. It was worse because it was subtle. It was a training memo about frequent flyers. It was a guideline encouraging staff to identify drug-seeking behavior early. It was a list of red flags that included things like multiple visits and requests for specific medication, which in the hands of biased staff became a net that caught the wrong people. They also obtained the audit logs. The logs showed that the earlier CT scan report had been opened by at least 2 clinicians. It was seen. It was there. It was not acted on. They deposed the ER doctor who first wrote drug seeking. He said he was concerned because Maurice had come in multiple times. The attorney asked whether he had reviewed Maurice's full medical history. He admitted he had not. The attorney asked whether he had checked the state prescription monitoring program. He admitted he had not. The attorney asked whether he considered that untreated pathology could cause repeated visits. He said he was just being cautious. The attorney asked him whether he used the same level of caution with white patients who presented with recurrent pain. He paused too long. They deposed a nurse who had described Maurice as agitated. The attorney asked what Maurice did. The nurse said he asked for pain medication repeatedly. The attorney asked how many times. The nurse said she didn't remember. The attorney asked whether it was unusual for a patient in severe pain to ask for relief. The nurse said it depended. It depended. Another phrase. Another shield. The hospital tried to argue that Maurice's cancer would have progressed regardless. The attorney brought in an expert who explained the significance of early detection, the difference in staging, the difference in treatment burden, the difference in prognosis. The expert used calm language, but the message was brutal. Delay mattered. Denise sat through meetings and depositions while also taking her father to oncology appointments. She learned to live in 2 worlds at once. In one world, she was a daughter making sure her dad ate and slept and kept his spirits from collapsing. In the other, she was a plaintiff reading medical notes that treated her father's suffering like a nuisance. Maurice did not want to be the face of a lawsuit. He said more than once that he didn't want trouble. He said he didn't want to be that family. Denise told him quietly that they had already been made that family the moment the hospital decided his pain was suspicious. Denise told him that if they didn't push back, this would happen to another man, another grandfather, another person who didn't have a Denise to read every page. Maurice nodded. Slow. He understood, even if he hated it. The case drew attention, not on the evening news at first, but among local advocates and health equity groups. A journalist filed a public records request for complaints against the hospital. A community organization asked the hospital to release data on pain management disparities. The hospital issued a bland statement about quality care for all. Then Denise's attorney did something smart. She tied the case to the hospital's own language, their own policies, their own training materials. She showed how a drug-seeking flag, when used without strict criteria and oversight, became a shortcut for bias. She showed how copying forward a suspicion without independent verification turned a chart into a machine that repeated the same accusation until it became truth. In court filings, the phrase appeared again and again: chart contamination. It was a simple idea with devastating implications. Once a patient's chart was contaminated by an unverified label, every future clinician approached the patient through that lens. The label did not just affect pain control. It affected urgency. It affected curiosity. It affected whether a doctor leaned in or leaned away. Maurice's chart, Denise argued, had become a trap. The hospital fought, then softened. They filed motions, then quietly asked for mediation. And in mediation, when the hospital's attorneys tried to portray the drug-seeking label as harmless shorthand, Denise's attorney slid a timeline across the table. On one side, the dates of Maurice's visits, his symptoms, his repeated reports of escalating pain, the CT scan that mentioned an abnormality, the lack of follow-up. On the other, the dates of the chart notes labeling him drug-seeking, the delays in treatment, the refusals, the lectures. The timeline looked like a staircase of harm. The mediator, a retired judge, studied it and didn't say much at first. Then he asked a question that made the room feel smaller. Why wasn't the follow-up done when the CT recommended it? The hospital's attorney tried to answer with process language, handoffs, documentation gaps. The mediator asked again, slower. Who failed? Silence has a sound when money is on the line. The settlement that followed was not a quiet check with a confidentiality muzzle. Denise insisted on terms. She wanted policy change. She wanted training. She wanted a review process for drug-seeking flags. She wanted an apology letter placed in Maurice's medical record, not as a sentimental gesture, but as a correction. She wanted the contaminated label removed. The hospital resisted, then compromised, then conceded more than they expected to concede. Because by then, the lawsuit had teeth. Experts were lined up. Depositions were ugly. And the hospital did not want a jury reading their notes out loud. Maurice received compensation, yes. It helped cover treatment costs that insurance didn't fully swallow. It helped Denise take time off work without drowning. But the larger win, the one Denise cared about most, was in the paper. New policy language, a formal review committee for behavioral flags, mandatory documentation standards requiring objective criteria, not vibes. Audits on pain management by race, reported internally with accountability. And Maurice's chart was amended. The drug-seeking label was removed and replaced with an addendum explaining the error and documenting the diagnosis that had been missed. The correction sat there like a small monument to the fact that sometimes a person can force an institution to tell the truth. Maurice continued treatment. Some days were better than others. He lost weight, then gained a little back. He got tired easily. He sat on his porch when the weather allowed and watched neighborhood kids ride bikes, the way grandparents do, as if the world could be simple again for a minute. One afternoon, months after the settlement, Maurice had a follow-up appointment at the same hospital system. He checked in at a desk and watched a young nurse pull up his chart. He watched her eyes scan. He braced himself for the flick, that tiny shift that signaled suspicion. It didn't come. The nurse looked up and spoke to him like he was just a patient. Not a problem, not a liar, not a case. Maurice nodded and said thank you, because that was Maurice. Denise, standing behind him with her folder, felt something loosen in her chest. Not forgiveness, not forgetfulness. Just the smallest relief that her father wouldn't have to fight the same fight again every time he asked for help. The hospital had tried to reduce his pain to a stereotype. They tried to treat repeat visits as proof of deceit rather than proof of need. They tried to let a label do the thinking for them. But Denise read the chart like a map. She followed the missed breadcrumb. She turned their own documentation into evidence. And she forced the record to tell the story it had been hiding. Not drug-seeking, help-seeking. And that difference, for Morris Ellison and for the people who would come after him, was everything.